Hi folks, Canadian Prepper here. Today on the channel we have special guest medical doctor Teimojin, season 9 alone finalist. Okay, 63 days in the wilderness. He came out to help me today organize my bug out roll, as you can see here, my bug out medical roll, and he's gonna help me not die in the apocalypse, because quite frankly, he was not impressed with my setup. And hey, what can I say? I don't blame him. I'm not perfect. So thanks for coming out, man.
Thanks for having me.
Let's get to it, buddy.
Let's go.
Hi folks, Canadian Prepper here. I'm here with medical doctor Teimojin, who also was a finalist on season 9 of Alone, survived 63 days in the wilderness. He took one look at my medical roll, my bug out roll, and he said, Nate, we're gonna have to do some rearranging. He took this thing back to the hotel room, you tidied it up. Now you're gonna explain why you organized it in the way that you do, and you have a very useful acronym to explain how you prioritize medical treatment in an emergency.
Absolutely.
So maybe you could explain that.
So when you open up a trauma roll or your first aid kit, you want to have some kind of way to systematically know what can kill you fast and how to address that. Because if you're in that situation, you're already stressed out, you might be bleeding out, you might not be in the right frame of mind. So you want things as simple as possible. So when you roll this out, how I arranged it is kind of the sequence in what you want to do when you're evaluating every single trauma patient that you see. Now there's some pouches that we can arrange a little further on if it were bigger. The general idea is to go through what we call the March algorithm. And this is not something I invented myself. This is something from the Tactical Combat Casualty Care algorithms. So that's what the US military uses, and they update it every single year. And that's how they prioritize things. Now March, it stands for massive hemorrhage, airway, R is for respiration, C is for circulation, so do you have a pulse or not, and H is for hypothermia, being too cold, or hyperthermia, being too hot. Why I also like including the H in there is because it blends in nicely with survival skills. Because let's say if you are truly bugging out and you're not having any rescue, your objective after you deal with that life-threatening injury is to maintain a good core temperature and to make that environment safe for you and your family. Even before you think about doing a medical type of evaluation, it's always about scene safety, whether that's active fire, whether that's environmental things, and most commonly, this is the type of thing that I would carry in my vehicle, because we're more likely to get into a motor vehicle accident than pretty much anything else right now. So the first thing you want to do is make that scene safe, whether that is signaling, dropping some road flares is a good idea. We have some mirrors over here for signaling as well, and some administrative things as well, like gloves. The first thing that I do after I know like my car is out of the way, there's flares to signal that that I'm in that area. Yep. You want to be managing massive hemorrhage. So your first M in that primary survey algorithm. So over here I have gloves that you can quickly go. One thing that I really appreciate about your rollout kit is the durability of the plastic. It's visible, and you can add on more panels, which is really nice.
Yeah, it is modular, just so people know, so you can add different mods.
Yeah. So as I'm getting gloved up and getting my protective wear, I have some trauma shears. I can go right in and cut the pants. People getting their kits, what I would recommend is go for a little higher quality trauma shear, because in all reality, if you're in all tactical gear, you're in kind of chest rigs, those things are pretty thick, and sometimes just regular trauma shears that come in your pack might not cut through it or cut through it efficiently. And you want to get to that wound as fast as possible. What I personally like is they call it X shears, and also Leatherman shears as well. Those are both really good ones. So we start off with massive hemorrhage. Your tourniquet should be at the ready. So Velcro off to the side, already primed to put onto that limb. And this is a SAM XT, and you guys also sell cat tourniquets, which is also a nice recommendation. I didn't take it out of the package because I'm not sure if you want to use it in other capacities, but this
should be out of the package. Ready to go.
Out of the package, primed just like this guy. And if you have kids or pets or an old person, you should be having some kind of tourniquet that you can use on someone who has a wrist or a limb diameter less than that. So about 13 centimeters in circumference. So if you can do that on someone, your commercial grade tourniquets are less effective. So you want something like this. This is a SWAT T. It's an elastic type of tourniquet or pressure dressing. So the main difference between that is if you stop the pulse and the bleed, it becomes a tourniquet. If you're just stopping the bleeding, it's a pressure dressing. So I really love this for the versatility and the fact that you can use it on kids, more specifically very small kids. And as we're going over here, we're thinking about other types of bleed. Maybe it's not a massive bleed, but they're bleeding pretty
So we're still in the M part of it.
Still in the M. That's why it's so important, because there's a lot that encompasses it. It's not just a tourniquet.
Yeah.
You know, we have some pressure bandages over here. This one's a big trauma bandage. Kind of looks like an Israeli.
I think that's an Israeli abdominal bandage. That's
Yeah.
an 8-inch.
So we got Israeli in the one version, Israeli in another version.
Smaller.
And this is something that I would like to have in kind of like my fanny pack, or having a SWAT tee with a tourniquet. So these are a little
And
more
those are
compact.
actually in 2 packages. So like the external package is vacuum sealed, but there's also another. So if a person wanted to, they could take it out of this package and it would probably still be sterile. But
Yeah. So moving on to the bleeding, you also have areas in your body that are not amenable to pressure dressings or tourniquets. So you want something that could stop a bleed in a different way. And my recommendation is having something ready for wound packing. So we have 2 types of hemostatic agents: quick clot, also similar to combat gauze, and ketosam, which both work and work differently. So it's nice to have some of this, because if you even have a small little bit of it, that can be the first thing you pack into a wound, and then you can pack the rest with just rolled gauze. And this is cheap, cents to get stuff like that. And then just other bandages as well. As we're going down, we talked about massive hemorrhage. Now we're talking about airway. So when we talk about airway, there's a few things that you can do. There's maneuvers that I teach my own students to make sure that the airway is as open as possible with just a manual manipulation. But if you have, let's say, someone who has a trauma, has an altered mental status, you're noticing that they're almost gagging on themselves and they're almost losing consciousness because they can't breathe. And you're trying to ventilate them, whether it's by your mouth or with a bag valve mask. That's that squishy thing that pumps oxygen in, and you're just not able to pump that oxygen in. There are devices that enables you to have a clear passage of oxygen from your nose to behind the obstruction.
Okay.
And typically you're measuring from the nose over here down to the ear over here.
So that'd be for if somebody was too overweight or something?
Typically, yes,
Yeah.
that'd be the case. But even some people who have an abnormally large tongue, or if that tongue kind of slips back because their muscles aren't active, that may be from a brain trauma or something like that, and it gets floppy and it flops back. This kind of circumvents that tongue. Other things related to airways is, this is more advanced. This is something that I would consider if my own family members were on the line and you had the training. Sometimes you need a surgical airway. So that's why I included some scalpels over here as well. So if you're thinking about the only way to circumvent an obstruction where your larynx is, your voice box is, sometimes you need to cut below that to put a tube there.
I seen a guy do that in a movie once.
Exactly. And a lot of combat
Several
medics do
times,
that
right.
in the field.
So you just cut a little incision and then you put a straw in there.
So you cut an incision in the right area. So I'm not going to describe this because I don't want anyone doing this at home. And then once that area is cut, then you have to go between 2 cartilages and puncture a hole, open it with this side. So you kind of puncture, put it in, twist it, and then you're putting in a tube there so that air can circumvent the voice box.
What level of training would you be trained to do that in?
So I would say combat medics.
Okay.
So people in the military or people in the ER.
Is that something you teach in your course?
It's something that we review, but something that we don't necessarily recommend to the average Joe that has zero experience doing it. So even as an ER doctor, we do it on cadavers, we do it on our patients, and we do it on simulations. So it does take some finesse. As we move down, we're going from airway to breathing. Another important thing is to have some way to breathe for a patient. Now this little tab over here is just a breathing mask, and it's just a little plastic thing with a valve to it. So this allows you to pump air into somebody without that vomit or grossness coming back into your system. Now these little filters would be okay for vomit, but let's say that patient or that person has COVID, it's not the same thing as a HEPA filter. So just make that decision. Right now, the basic life support, if you are not comfortable giving rescue breaths, you're just doing chest compressions. Other things for airways and respiration, chest seals. So we talked about that in our other video. So if they have a big sucking chest wound, this is the front and back that you can slap onto that wound so no air is coming in. And then if you are getting those advanced trainings that You can solve a tension pneumothorax, a collapsed lung. These are needle decompression needles, and they're basically creating a way for air to escape, so it's not causing pressure inside the chest wall. So these are two versions of that. Also relevant in upper airway stuff and breathing stuff is anaphylaxis. So if you have anyone in your family that has that, whether it's bees or peanuts or whatnot, having an EpiPen on hand is super important.
To get the EpiPen, Jace Medical.
So when we talk about circulation in that March algorithm, that's mostly your clinical skills, your ability to feel a pulse and to make that decision of whether they have a pulse or not. Because if they don't have a pulse, you're doing chest compressions, and that's your way to save that life. You don't have an AD kit in here, but that would be part of that circulation type of deal. And sometimes they're small enough to fit over here. I did include like a razor there just to symbolize if you have a guy with a hairy chest, you would shave that and put those AED pads on. So as we move down, we talked about the massive hemorrhage, the airways, circulations, the respirations, and now we're moving on to kind of the hypothermia. So if you want to switch positions, we'll kind of
yeah. What about this stuff here?
That is later on. So my students learn about this, but it's not necessarily in the March algorithm. So I'll talk to you guys a little bit about that as well. So as we learn hypothermia, which is very important specifically for trauma, because if you're cold, specifically hypothermic, clinically hypothermic, you're going to bleed more. So that's why it's so important to have things to keep warm. So we have things like these Malar blankets. These are great for one-time use, but if you're someone who's in the bush, a hunter, or if you're running from marauders, this is gonna rip so freaking easy. It just takes one little twig, puncture, and it just rips in two, just with the wind. So I recommend that people invest in something a little more robust. Nate has things like this in his stock, and he has an even more durable one that even if you puncture it, it's not gonna just rip apart. So these are a little more durable.
It's like an emergency bivvy, kind of emergency sleeping bag made with Mylar material, but it's a slightly thicker gauge.
Absolutely. So if you're able to wrap your victim or yourself into that and have a way to actively have heat, that's super important. So you either have some like hand warmers or chemical warmers, and you have another chemical warmer over here that you can put into there. Keep it on the chest or in the armpits, and then wrap yourself pretty tightly with that. And if you have a wool blanket, you can kind of layer on and put that this stuff on top. Some renewable heating sources, you can get Arctic candles. This one lasts 9 hours. So if you're in the situation where you're kind of bleeding and waiting for buddy to like meet you at the rendezvous point, and you have some kind of Malar tarp system, you just need to put one of those candles in between your legs, sit on something like these sandbags, and as you're covered, you have that candle beneath you, and it's just warming you up.
BTUs,
Exactly. If you need to make a fire, definitely recommending people getting comfortable with ferrocinium. And also, if you have ferrocinium, add some magnesium, because that's a sure way to get a high heat, even with wet wood. So those are important. They have some commercial grade survival kits like this one. These are all right, but I would say every element in here would be better served with a bigger, more robust version. So this little ferro rod, I would much rather have one of these. These little bit of matches and signaling things, I would much rather have that and a fat burning stick like this. So this is kind of something that gives you a sure way to start a fire, because it's a ready-made tinder. And then when you think about, okay, you are having that initial shelter, you might want to have a bigger shelter around yourself. So things that may be valuable would be a tarp and a way to make a shelter with that tarp. So we have two different types of cordage. I love small gauge cordage like this for the majority of stuff. Some paracord, 550 paracord, about 50 to 100 feet is useful as well.
This is a Kevlar cord, so it's very durable.
Super durable, and it's a 320-pound test. So that's incredibly useful. So the things that my students particularly learn also learn 2 steps above the March algorithm. That includes concepts related to exposure, and also D, which is when we do our acronym, it's marched. So March plus ED. The D is debility, and that includes things that affects your ability to move, whether that's a stroke, whether that's a head injury, spinal injury. For debilities, that also includes fractures and spine injuries, head injuries. And we have things to solve that issue. So we have fracture stuff as well.
Talked about that in yesterday's video.
Exactly.
Go and check that video out, because he provides a lot of useful tips for all of the stuff that we're talking about today.
Things for fractures and sprains. You got triangle bandages, some tape, some...
What is this?
This is kind of stretchy tape. So if you have like a bandage that is a self-adhering thing, that's multi-purpose. But I like this also for sprains. So if you have an ankle sprain, you don't think it's fractured, but you just need a little bit of support, and you want to fit your foot inside a boot and not have anything bulky, things like this and athletic tape are really, really useful. Me personally, I carry athletic tape, which has a kind of like an adhesive side to this.
Like a K-tape? Is that
Yeah, like a K-tape, exactly. Okay. So I use that almost all the time when I'm hiking. So besides that, you have some triangle bandages, some duct tape, some icy hot things for some bangs here and there.
And so how does the icy hot work?
So it's kind of like a chemical pack, and typically that chemical reaction, once you break into it, allows things to cool. Okay. And typically when you initially injure something, the cool is going to inhibit some of those inflammatory markers, decrease the swelling and so forth.
So we got things that heat and things that cool.
Things that heat, things that cool. Also with your summer, hotter locations, you want things that help you cool. So that might be cooling rags, that might be cold packs, and so forth. Besides that, we also have a section. So ideally, how I would probably do it is the marched ED kind of algorithm from front to bottom. But because some of the pockets are different size, I arranged it like this. So when we're thinking about all the trauma things are fine, you did your evaluation and they just have some boo-boos, always nice to have a first aid kit that's just minor stuff. Yeah. And the reason why I left it inside its package is because it's very visible that, hey, this is just like a first aid kit. Mm-hmm. This is something for your boo-boos. And I like adventure medical kits because of how well they're labeled. If you open it up, it flaps out and it says different types of boo-boo type of injuries. Yeah. So I like that for that, and it's visible. And with this too,
what we've done in the past is we've used those label makers. You can actually have a label that adheres to the vinyl and adheres quite well, and that will tell you exactly what's in that specific compartment. So
that's what I would recommend, because you want to make it so as dummy proof as possible, so that anyone in your family or anyone that you toss your kit to can open it up and be like, that's the thing that I need for your problem.
And this is why I think the roll is so amenable to this concept, because of that optical visibility there. Anybody can really see at a glance what's inside it, right? So that's why we wanted it this way.
Absolutely. So besides boo-boos, we also have some wound care stuff. So you had some chlorhexidine. So that's good for cleaning areas. So when I'm thinking about starting a minor surgery or cleaning my instruments, I typically use chlorhexidine or iodine. So this was a useful thing. So besides that, we talked about some pressure wash material. So I love that you have a heavy gauge syringe over here. We have some lidocaine, and again, some spare scalpels and staples as well for those minor-ish wounds.
Most people are not going to have a reason to use a scalpel because they're not going to have the training. So it's in there, I guess, if hopefully we have an expert like yourself around when bad things happen, but...
you can trim your calluses.
Sure.
And abscesses.
Minor manicuring.
Are very easy to deal with. So if you're part of our group, you'll learn how to drain abscesses.
I have had to do that, so
it's just
maybe there is a utility to it.
So that's how I would organize your roll, and how I would make it very simple, so that every time you see something bad happen to someone, you roll it out and you're able to save that person's life.
Identify right away. Yeah. You know, I think what I'm going to do is war game a little bit and do a little exercise, because in an emergency, you know, there's all kinds of stuff happening. Being able to know exactly what you need is important, and maybe just running a few exercises, drills with the family, you know, is a good way to get familiar with where everything is located. Even though everything is visible, it's still one of those things where if you can have a triage-like system like you're doing here, then I think that's going to be incredibly useful. So, all right, guys. Well, Dr. Tan, thanks for coming out. I would encourage you to go and check out survivaldoctors.com, where you can get some high-level training. 30 days free trial, and then if you want to continue thereafter and get even more advanced training, then I think there's a course that you can pay for, but the first 30 days is free. Go check out his YouTube channel. We're going to be doing more collaborations in the future, I'm sure. Get your bug out rolls at canadianpreparedness.com, and don't forget, if you need any medications like antibiotics and EpiPens, you can check out Jace Medical through the link in the description below. Thanks for watching, guys. Take care.
The best way to support this channel is to support yourself by gearing up at canadianpreparedness.com. where you'll find high-quality survival gear at the best prices, no junk, and no gimmicks. Use discount code PREPPINGGEAR for 10% off. Don't forget, the strong survive, but the prepared thrive. Stay safe.